as you all know, CRC Davanagere continuously conducts many awareness and training programs all across the year so that we can spread awareness about the topics that are of concern for many people who are having children with special needs, many professionals who are working with children with special needs. So, continuing with the same, today we are going to have yet another program on the occasion of International Epilepsy Day. As you all know, International Epilepsy Day is celebrated on the second Monday of every February. So this time it is on 14th February 2022. And the national level webinar today is on childhood epilepsy, identification and management. I would like to extend my thanks to our patron Shri B.V. Ramkumar sir, who is the officiating director of National Institute for the Empowerment of Persons with Intellectual Disabilities. I am also thankful to our director in charge, Dr. Gyanvel K. sir, for giving us this opportunity. And special thanks to our speaker, Dr. Yatish B.L., who is the director and consultant pediatric neurologist at Dimani Child Neurology and Developmental Center, Shivamonga. So before we begin, instruction for participants that kindly do not click share screen option, and if possible, keep your audio and video on the mute mode. You can type your queries in the chat box. We will be taking them up with our expert for the day. Just a small introduction about CRC Davanagere, Karnataka. CRC Davanagere is one of the 23 CRCs in the country established by Department of Empowerment of Persons with Disabilities, Ministry of Social Justice and Empowerment. It is under the administrative control of National Institute for the Empowerment of Persons with Intellectual Disabilities, NIPID, Secunderabad. It works for the skill development, rehabilitation, and empowerment of persons with all 21 types of disabilities. And the services that we provide here include psychology, special education, occupational therapy, vocational training, physiotherapy, prosthetics and orthotics, speech therapy, and social services. Apart from that, early intervention services, skill training, and training programs for B.Ed in special education, in ID and hearing impairment is also provided. And at the same time, guidance for UDID, DIP schemes, and scholarships for PWD are also being done at this center. I would also like to tell you about the wonderful initiative by Department of Empowerment of Persons with Disabilities, Ministry of Social Justice and Empowerment, Government of India, about the 24/7 mental health rehabilitation helpline, Kiran. This helpline is free of cost, available round the clock all across the year, pan-India, and anyone who is suffering from any kind of depression, anxiety, suicidal thoughts, obsessive compulsive disorders, panic attack, or any mental health issues can call on these numbers. And there are experts from all across the country who are ready to help you out at any given time. So before I introduce the speaker for the day, I would like to call upon my colleague and the coordinator of this program, Dr. Thamrai Silvan sir, who is a lecturer of physiotherapy at CRC Davanagere, to extend a welcome to all the participants. Over to you, sir.
So, good evening, one and all. Myself, Thamrai Silvan, lecturer of physiotherapy from CRC Davanagere. And thank you, Dr. Neeraj sir, for your introduction. And today I would like to welcome you all the participants along with the renowned resource person of today's program, Dr. Yatish sir. And we have been chasing sir for since a long time. And due to sir's busy schedule, we were not able to reach. And today, summer, we got the appointment of sir for this wonderful event, International Epilepsy Day 2022. And it's going to be an interactive session for you all. And I hope this session is going to be very useful and informative for you all people. I request all the participants to better utilize this as resource, and also I would like to tell you about the CRC's the recent achievement one, and we got the approval to establish the CDAIC. It is a Cross Disability Early Intervention Center from the Ministry. So it will be functional after 2-3 months, and we got the approval now. So we are going to establish a state-of-the-art early intervention center in Davanagere. So we are going to serve for the entire Karnataka. So we are going to get more manpower and the infrastructure. So thank you. And also we are going to have our own building. And this month and probably we are going to have a Bhumi Puja for our CRC Davanagere. It is some 3-4 kilometers from the Davanagere, outskirts of Davanagere. So I once again request all the participants, please mute your audio so that there will not be any disturbance. As this Nagaratna ma'am, please. Sorry.
Yes, sir.
So we are going to have our own building by 1 or 2 years, and we are going to have a Bhumi Puja, as I told you, by end of this month. And once again, we as a team, a CRC team, and we would like to serve even in a better way for the person and the children with special needs. And thank you one and all the very best for your today's webinar. Now back to coordinator Dr. Neil Singh sir. Now the screen is yours, sir. You can take.
Thank you, sir, for welcoming all the participants. And now moving ahead is program. It is time to introduce you, all of you, to the stalwart of today. Yes, as sir has told you, we have been chasing sir for a long time to gain from his experiences about the wonderful work that he is doing in and around Karnataka. So today we have with us Dr. Yatish BL sir. Sir has done his MBBS from MS Ramaiah Medical College, Bangalore, BCH from Vijayanagar Institute of Medical Science, Bellary. Sir is a gold medalist in DNB from Amrita Institute of Medical Sciences, Kochi, and also PGD in Developmental Neurology from CDC, Kerala. Sir has done his fellowship in Pediatric Neurology from Amrita Institute of Medical Sciences, Kochi. Currently, sir is the Director and Consultant Pediatric Neurologist at Dhimani Child Neurology and Developmental Center, Shivamogga. Sir, as I told you, is a gold medalist in DNB Pediatrics in 2009. Many papers presented in zonal and national conferences and delivered various faculty lectures and conducted workshops. His area of interest are neonatal neurology, neurocritical care, neurodevelopmental disorders, neurometabolic disease, and pediatric epilepsy. So when we thought of doing this program, we could not think of anyone else other than Dr. Yatish sir, because not only for the qualifications that I have told you, but today I am telling you another thing. In CRC Davanagere, almost 60% of the children that are coming to CRC Davanagere are being sent by Yatish sir. So he is not only doing a job in his domain, but he's also guiding these children to the correct place where they can get continued rehabilitation services. So over to you, sir. The screen is yours. We can go ahead with the introduction, and after that we will start the interactive session whenever you say. Over to you, sir.
Okay, thank you, Neeraj, for inviting me and for this wonderful introduction. And is it audible? Hello?
Yes, sir, you're audible.
Yeah. So thank you for the introduction. As you already mentioned, today is the International Epilepsy Day. So we have to use these days to create the awareness among the public. And so you are doing a great job by arranging a webinar, because as all of us know, the majority of the more than the knowledge or the current information, there are so many misinformation which is around the epilepsy, especially in children. So today we'll try to solve or answer these misconceptions. So we'll take up the questions, or we'll have, because as it is an interactive session, so I don't made any PPTs. So those can ask the questions so that we can interact directly. And before starting the introduction, as majority, I don't know whether they can understand English, or how many are from outside Karnataka?
Many, sir. Actually, it is a pan-India webinar, so we have participants from all across the country.
Then we will continue in English only.
Yes, please, sir.
Yeah,
and what we will do, sir, we have prepared a set of common questions based upon the feedback from the caregivers. We will take that up with you. We will take that up with you one by one, and after that, if anyone still has any questions, we will open it to the participants. Participants are mostly from caregivers and professionals, rehabilitation professionals. So I hope it should be appreciated by one and all. So I'll just share the questions one by one, and then we can take a discussion on that. Just give me a moment, sir.
Sure.
Okay, so the first question that is very commonly asked is that what exactly is epilepsy? So we would want you to guide us about that, sir.
Okay. See, here all of us have to understand two different things. One is the seizures, another is the epilepsy. So both the seizures and epilepsy, they are different. The seizures can occur because of many reasons, and more than the seizures, especially in a pediatric age group, we'll have some conditions we'll call it as a seizure mimics. Means they will look like seizures, but they are not the true seizures. So to say make it simple, all shakes are not seizures. So just because the child is having some abnormal or involuntary movement, don't consider them as the seizures. So the seizure is in a abnormal and is a excessive synchronized electrical discharge from the neuronal activity. To explain it, so what will happen? Our brain will have normal electrical activity, which is be in the microvolts. So we will not be able to either record it very easily. So in those who throw the seizures, this electrical activity will become very excessive, means it will become very high voltage, like a high voltage current, we can say that. So that it will manifest as an abnormal movements, like the stiffening of the extremities, uprolling of the eyes, and will lose the consciousness. And this seizures, we call it as a semiology, means the type of seizures depends on from which area of the brain this discharge is coming, whether it is a generalized where you will have the stiffness of all four limbs, or it will be focal, confined to the either only one side, only to the face or other thing. So it has got both motor manifestation and non-motor manifestation. Motor manifestation means all of us will be able to recognize something is going on abnormal. In non-motor, that means the child will become suddenly unresponsive, will become silent. Especially in absence seizures, you will have some eye blinking episodes. And some will have only the speech disturbance. Some will have a memory impairment. Some will have the cognitive or behavioral changes. So the seizures, it need not to be always in involuntary or the motor movement. It can have other kind of manifestation, which we call them as a non-motor manifestation of seizures. So the seizures, we take it as either it may be an acute symptomatic seizures or an epilepsy. So here we need to understand it, the very important, as Neeraj was asking the question. So acute symptomatic seizures can be due to the acute symptomatic causes, or it may be because of the epilepsy. Those who have epilepsy, they will have a tendency for the recurrence of the seizures. Means if the child throws 2 seizures more than 24 hours apart, we will call it as an epilepsy. Or there are other definition also, where if the child comes with one episode of seizures, and if you think that there is a chance of recurrence, and if we fulfill the criteria to label it as epilepsy, you can label it as epilepsy. So epilepsy and seizure they are 2 different entities. So those who have epilepsy have a very high chance of the recurrence of the events. Either it may be motor or non-motor. Then we will call them take it as epilepsy.
Thank you, sir. Very well explained. The difference, this is very confusing many times amongst many professionals also, that the difference between seizures and epilepsy. So, sir, this brings us to the next question for today, that how common is seizure disorder or epilepsy in children?
See, this seizures or epilepsy, we call it as a bimodal representation. The bimodal means it has got the maximum number of cases in the early age group and in the older age group. So the maximum number usually we see in the less than 5 years, then there will be second peak in the adolescent, and the late peak in the old age group after the 65 years of age. Okay. So in to say as a number, the number can vary in pediatric age group depending whether you are seeing the neonatal newborns or you are seeing the adolescent or the other group. So roughly the incidence can vary from 80 to 100 to a 10 to 20 per 10,000 population. Here again, there are 2 important things. There is one is a prevalence of epilepsy, another is the incidence of the epilepsy. The prevalence means those cases will be always there, it will be there in existing society. The incidence means the new cases. So the new cases of epilepsy will be the roughly around the 2 to 3 per 1 lakh population. Hello.
One minute. Thank you, sir. So the next question is that is there any difference in the epilepsy types and presentations in case of children and in case of adults?
Yeah, because there is a lot of difference between the pediatric epilepsies and the adult epilepsy. The difference in terms of the presentation, because the seizures presentation vary according to the maturation of the brain, especially in those who are newborn, just born babies. There, the seizures or epilepsy, they will manifest differently. Whereas in till 1 year, they will manifest differently. And after that, it will manifest differently because the brain is not completely matured enough in the pediatric age group. So that is where the problem comes in the recognizing of the seizures and epilepsy in the pediatric age group. So the majority of the times, either even the trained or experienced or qualified the practitioners, sometimes they can miss the seizures to some other abnormal movements. So they are sometimes they are very subtle, like maybe like just shaking, jerking. Or it may be in the form of just the child may be crying excessively. Or sometimes it will become just vacant for some time, like a behavioral arrest, that it may not be recognized very easily. So in other words, the most common thing is generalized, where the child will have crowing of the eyes and shaking of the all extremities. So those kind of seizures we can recognize easily across all age groups, from the newborn to the older age group. But in pediatric, their presentation will be different according to the age of the child. And the other thing, when you come to the diagnosis, we'll have more of the syndromic presentations in pediatric age group. There are certain syndromic epilepsy in less than 1 month of age group. Till 4 years, there will be other epilepsy syndromes. In adolescent, there will be other epilepsy syndromes. So, as I told you, because the brain is still maturing, the type of presentation of seizures, the causes, and epilepsy syndromes will differ across the age group.
All right, sir. So, as parents of children with special needs, what are the signs that we should watch out in case we are suspecting that our child might be having epilepsy?
See, so here I have made it very simple, because as I told previously, all shades are not seizures, and it is very difficult to recognize for a common person, or for a non-medical person, or those who are not trained. So what nowadays I will advise, and thanks to the advance in the technology, now the mobile phones are available everywhere. And I think the mobile phones with video is also there in almost every alternate home, we can say that. So those who feel your child is having some abnormal thing, you feel if the child is saying it is not normal, just make a video of it. Okay, so then we can show to your caregivers. It will help us to recognize whether that event is a seizure or it is a non-seizure event. If you are not able to record the thing, you just observe it carefully. What was the event from second to second, because as these events last for sometimes for a fraction of seconds, so you may not be able to record the video also. So in those cases, we need a clear-cut the explanation from the parents. So one thing everyone will be recognized is the generalized. That's what we see in a movie theater or everywhere. So other things are, if the child is playing, suddenly he will become unresponsive. Then he will continue to play, like it is a vacant stare or a behavioral arrest. As they will have certain like jerking of the extreme. Suddenly they will jerks. They will jerks very sporadically or in a clusters. There may be so many types. So because it is very difficult to describe for the public the each and every second moment to moment, and easy to record the video wherever it is possible. So I will recommend, if you are suspecting something is abnormal is going on your child, please do a video recording, and especially so in this multiply disabled or kids, because it is sometimes it is very difficult to differentiate which is is normal behavior, whether it is a stereotypic behavior or it is in a epilepsy. Because especially if you see autism, they will have flapping and some so many stereotypic behaviors. So in those cases, it will be very difficult to recognize it. So if you are able to make a video, it will be good, so that it will help us to recognize whether it is in a seizure event or it is a seizure-like event.
Thank you, sir. Yes, very rightly pointed out that instead of trying to figure out by yourself or just imagining based upon, as sir said, you see in movies or something, it's better if you are suspecting something. Now technology is with you. Make a video, meet the expert, and let them decide whether or not it is a seizure or it is something non-seizures kind of a presentation. Thank you, sir. So my question next to you would be that, is childhood epilepsy treatable?
Yeah, see, the treatable question is, it is rightly mentioned, there is a difference between treatable and cure, and by and large, all majority of the seizures, about the 60 to 80% of the seizures or treatable, or we can say that we can curable. Only the remaining the 22%, 20 to 40% of the cases, they will be very refractory or recurrent, or they may require very long-term medications. So just because your child is having seizures, epilepsy, don't go into depression, or please don't break down. So majority of them, about at least 60% of the seizures, they will self-resolve over a period of time. So it is only the time and the medication which will tell us. And as the literature goes, the 60 to 80% of the epilepsy will able to cure, or if not cure, at least will able to control them. Only the remaining 20 to 40% of the cases will have trouble in managing them.
So that's some eye-opener discussion today, that almost 60%, as sir has pointed out, 60% of a childhood epilepsy is treatable. So just in case you know someone who is having childhood epilepsy or similar symptoms, it is time you get professional help, and almost 60 to 70% of them would be treatable over a course of time. So sir, my next question to you would be, how long should the treatment be taken for such conditions?
See, the treatment for seizures or epilepsy depends upon the epilepsy underlying etiology. Okay. So for example, if it is an acute symptomatic seizures, if the child is having a seizure because of the fever, that is the most common type of seizures in pediatric age group, that is, we call it as a febrile seizures. It doesn't require the long-term management. You can, if you are able to control the temperature, it is more than sufficient. Or you can give the drugs only during the fever episode. Or if the child is having a seizures just because of the disturbance in the calcium or sodium or sugar, we can, if you are able to correct it, there is no need of the drugs there. For other conditions like in the traumatic seizures or the post-infectious seizures, if you are able to control the seizure for 3 to 6 months with the medication, it will be sufficient. But other than these things, the majority of the seizure treatment will be required around, to make it simple, by and large, around 2 to 3 years of the anti-epileptic drugs or anti-seizure drugs. Very rarely they will require the long term. It depends on the etiology and the type of epilepsy syndromes.
Thank you, sir. When is the right time to stop anti-epileptic medications? For how long? As you have almost pointed out. Still, why I am asking you this question, because many times parents, what they will do, they think that, okay, my child is seizure free for almost a year now, and suddenly they will stop taking the medications. So what would you suggest to such parents? When is the right time to stop these medications?
So, because this is the most common question, and majority of the parents will do make a mistake. Even today, in my OPD also, 2 patients, they have stopped their medication by themselves. Now they came with the breakthrough seizures. See, my sincere advice to the all parents or all caregivers is, please do not do self-medication, or please do not decide yourself. If somebody has started the medication and if he has told to give for a long term, before stopping them, please take their opinion. So for your information, the duration of the medication, as I told you previously, depends upon what is the reason for the seizures or epilepsy. So in general, if the child is seizure free for 2 years, we can consider stopping the medication, but it is not, there is no one-to-one relation here. So because there are certain type of epilepsy, like juvenile myoclonic epilepsy, where we can control the seizures very easily, even if it is single drug. But the moment we try to stop the drug, they will have a breakthrough seizures. So the 2-year period or 3-year period, it is not applicable in all cases. but it is the practice or to make it very easily understandable. To if you are able to control the seizures for 2 to 3 years, you can try to taper the drugs or take off the medications.
Thank you, sir. Could you also highlight here the importance of EEG assessment for discontinuation of medications?
Yeah, because see, the EEG in as a major role in diagnosing, monitoring, or while stopping the medications also. And especially video EEG, because the majority of the abnormal movement, whatever we see, or may not be the seizures as I mentioned. So if you do the EEG with video, it will helpful for us. When it comes to the stopping of the medication, there are certain means if the EEG is normal, then we can definitely try to taper it up. But we cannot expect normal EEG in all case scenarios. Sometimes the EEG may remain abnormal, but still we can give a trial of tapering or the taking of the drugs. So whether EEG per se, whether it is a normal EEG or an abnormal EEG is not.
कोई नहीं अपने तो कोई यहाँ दिक्कत नहीं है, बेचारे बच्चे भी ऐसा कुछ नहीं साइड में कोई वो नहीं है, और बच्चे भी अब तो भी कोई ना कोई जाता ही रहता।
Sorry for this interruption, sir. I think some participant had unmuted themselves. Yes, please. Thank you, sir.
If the child is means if the EEG is normal, definitely we can take it. But in the meantime, it is abnormal. It doesn't mean that we cannot taper the drugs. So it has to be decided on case-to-case basis.
All right. Thank you, sir. There is one more thing that, as you said, it is very common that children might have these epileptic attacks or seizure episodes. So suppose we are in a place, in a general public place, in a classroom or in a market or something, and if someone has an epileptic attack just in front of us, what should be the first aid that we should give as a common person over there?
So this is the one common thing. All of us should know. Every public should know what is the first aid for the seizures, because the seizures can occur to any person in any place at any time. So as it can come at anywhere for anyone, we should know what we need to do whenever the person is having a seizures like activity. And it is very simple. It is not a very complicated thing. So first we have to make sure that the place is safe. So if there is in the I building or near to the water, near to the fire, we have to move him from that place and loosen his clothes and make sure that ventilation is good, and turn him to a left lateral position and keep it in that position till the seizures activity stops. So by turning him to a one side, if he's drooling or if he's vomiting, that will goes out. So it will not interrupt in his respiration. And majority of the seizures, they will stop within 2 minutes or 5 minutes. They are unlikely to go on for 5 to more than 5 minutes. If seizures goes on for more than 5 minutes, we have to take him immediately to the hospital. If the seizure stops within a 5-minute duration, once it stops, till he becomes fully conscious, we can allow him to lie down and relax. Till the seizures stops, don't give anything for him to drink. And here there are certain do's and do nots I will mention. So do's means if you are able to do whatever I said is more than sufficient. But every tradition has got its own practice. Someone will keep finger in the mouth, someone will keep some iron piece, so on. There are so many practices. So don't do any harmful things. So especially the branding and putting the finger in the mouth and giving something to drink. So these are the, please do not do these things because they are harmful at certain time.
Thank you, sir. This was very, very important information actually. And the golden line that we can take from this is anyone, anywhere at any time can have a seizure attack. So that's why it is very important to be informed what to do, but it is equally important what not to do. So as sir has rightly pointed out to all of us, many times we see that due to lack of awareness or ignorance or certain practices that have been followed, you come across people putting finger inside the mouth, putting a spoon inside the mouth, someone trying to put a shoe or a leather to smell. All this, with sir's permission, I would like to highlight here, are not at all an effective method to control and should be avoided at all costs. Thank you so much, sir, for highlighting this valuable point at this stage. So there is one more question, sir. Many children who are having history of epilepsy and seizure disorders, are there any day-to-day precautions also that we should take with such children?
See, yeah, precaution definitely depends upon the type. So the first thing what I want to tell all parents is, first you give the medication on time. So that is the most important precaution we have to take. Please do not give the medications irregular timings. So give the medication at a regular interval, whatever your doctor has advised. That is the first thing you have to do it. So second thing is avoid excessive screen time, because the screening it has come in many things, but especially those who have epilepsy, the excessive screen is not a good thing. And you should have adequate sleep. So sleep is the another important thing. When it comes to the adolescent, those especially as in a teenage, please don't allow them to develop some habits, because majority they are all CNS stimulants, whatever it may be, whether it is a tobacco or alcohol or something else. So this all can precipitate the seizures. So to summarize, you should take the medications on time. So avoid unnecessary screen time, adequate sleep, and avoid habits.
Thank you so much, sir, for this valuable piece of advice. And just one more question here, sir. Is precipitation of a seizure attack also possible in case of dehydration in?
So, hello?
Yes, sir. Yes, please.
Yeah, so the dehydration per se don't precipitate seizures. If it is having a fever, so fever provoked seizures, what we call. But the fever means acute, especially we can make it this, whenever child is acutely ill or whenever he is a need to take care of him efficiently or more adequately.
All right. Thank you, sir. This brings us to the next question today. What are the long-term complications of epilepsy in children?
The long-term complications of the seizures, we can classify in so many ways. Either they may be the medical long-term complication, social long-term complications. When it comes to the medical complication, as I pointed out in the initial itself, majority around 60 to 70% of the seizures are either treatable or curable. So those usually they will not have many complications or any issues. So when it comes to the complication, usually complication we will see in a refractory cases. Those kids who require more than 2 or the 3 drugs. Here, there is one more important thing we need to understand. The complications will be occurring because of the underlying cause, one thing, or because of the medication which you use to control the seizures. So here the complication may be varying from the the cognitive impairment to the behavioral changes and to the other medical complications. So more than medical complication, there will be in our society more of a social stigma that I think is still, even though we are in the 21st century, globalized world or the digital world, these social issues or social complications are still exist. And so we can, this psychosocial issues we need to address more than the medical complication, because medical complication occurs in only in a less number of cases.
Okay, so as I can understand, a holistic approach towards their rehabilitation should be undertaken. And yes, many domains can be affected because of epilepsy in children. And sir, as you have pointed out that there is a stigma associated with epilepsy. So there is a myth in our society that epilepsy can occur due to certain bad deeds or certain sins done by people, or it could be some witchcraft. So can you please highlight, sir, what is the cause of epilepsy in children? Are these one of the causes, or these are all myths we should now discard?
See, it is proven beyond doubt. The seizures or epilepsy, it is a biological disease. If I say biological means it occurs because of this some dysfunction at this cellular level. The cause may be, it may be varying causes. It may be varying from the genetic or hereditary causes to the head injury or a tumor, infection, some metabolic impairment, and some chromosomal or genetic abnormality. The cause may be different, but it is a biological disease. It will never be caused by other things. So those are all just because I will tell all my patients. See, our the parents or our ancestors, they have made the things simple so that to understand the public. So that's why all these beliefs have come, whether you can say whether they are true or false beliefs. Because if you understand or if you go into philosophically about these beliefs, they have made in such a way that it will be very easy for the public to understand it. But over a period, those beliefs have been misrepresented. So rather than conveying the true meaning of that belief. So please don't believe in all those things. Seizures or epilepsy is a biological disease. It is not caused by any other thing.
Thank you so much, sir, for this word of wisdom. Yes, this advice and this knowledge is going to be very helpful. And today, I would like to request all participants that you, wherever you go, spread this awareness, because many times children with epilepsy, adults with epilepsy are stigmatized because of these long held, myths in their mind. So thank you so much, sir, for highlighting that it is only a medical cause which has been proved beyond doubt. Sir, one more question we have. Can children with epilepsy exercise or play like other children?
Definitely. See, if the seizures is well controlled, so they can, because see, our motto or our aim are treating these kids to have them a normal life, which means the better quality of life. If they have very well controlled seizures, they can do the normal activities as the normal kid does. So there should not be any difference at the activity level if the seizures are well controlled. If the seizures are not well controlled, then also they will be do all these things. But I will advise here under supervision, at least some caretaker has to be present while child is playing or while child is doing a cycling or swimming or other things. Suppose if child develops the seizures all of a sudden, there should be some person to attend it in a poorly controlled seizures. If it is a well controlled, they can lead a near normal life like any other kid.
Thank you, sir. And one more question I would... Ma'am, 1 second, ma'am. We'll take questions from the participants after this. Just
Okay.
a few
Thank you,
minutes.
sir. I have child from teacher.
Sure. We'll give you an option to ask. Ma'am.
Okay.
Please mute
Thank you.
yourself. Yeah, thank you. So one question that is very commonly bothering the parents of children with epilepsy, that as when these children will grow up, will they be able to take up jobs, have a married life? Will they be able to be like any other adults in society, or they will be lagging behind in the long run?
See, this is a very common question, or more than question, it is a common misconception. See, the majority of the kids or adults with epilepsy, they can lead in a normal life, like any one of us. Okay. So there are so many, if you take out your friends, will be knowing whether he's having epilepsy or not. And they will be leading a normal life. Only about those who are poorly controlled or refractory, where there will be some issues. Just because he is having a seizures or epilepsy, it doesn't mean that he should not do any other activities. He can lead a normal life.
Thank you, sir. And when we talk about the misconception, there is one more misconception prevalent in the society, that children or adolescents who are having epilepsy or seizure disorders, if they get married, then they automatically become all right. How true is this?
So it is not true. Okay. So here, the only one important advice for all parents is, please reveal the underlying disease before going or getting for this marriage or engagement like of things. Otherwise, it will create other social problems. So if the seizure is especially for example like a juvenile myoclonic epilepsy, it is almost a lifelong epilepsy in certain groups for majority of the groups, but it can be very well controlled. So just because we are transferring the kid, it doesn't mean that seizures will be cured. So please don't interpret such like that.
Yeah, thank you. Thank you so much for highlighting this point, because however strange it might sound, from all across India, many parents visit and ask this question to us, sir, if we get the child married, will it be okay? So thank you so much for highlighting that. These are all misconceptions, and yes, only the method to treat is to get a proper professional help for the prescribed duration, and it would be beneficial to the children in long run. So thank you so much, sir, for the wonderful explanation and to highlighting all the queries that we have asked you. Now the session is open to the participants who can put their questions in the chat box. There are already few questions, sir. With your permission, we are almost nearing time towards end. So we will be taking 5-6 questions. And after that, we can let go. Other questions can be taken on later, or we can send to us and we'll be sending it over to the expert. So anyone who wants to ask any question can please go ahead and type their question in the chat box, please. I'll be taking the questions one by one now.
Sir.
Yes, please, ma'am. You wanted to ask something? Please. Please go ahead.
Sir, I am a mother of Down syndrome baby. She is 38 years old. Okay. May I ask in Hindi?
Yeah, can continue.
ओके, माय चाइल्ड जब 5-6 साल की थी, थोड़ा सा चौंक रही थी। ऐसे डॉक्टर ने बोला जी आप एपिलेप्सी थोड़ा स्टार्ट हुआ है, इसीलिए आप सोडियम वालप्रोट दीजिए। लेकिन मेरे को पता नहीं था एज का हिसाब से वो मेडिसिन थोड़ा हायर करेगी। लेकिन फिर जब बीच में थोड़ा बंद हो गया था, अभी जब 32 इयर्स हो गया है, शी इज एक्चुअली प्रेसिडेंट अवार्डी एंड ओडिसी डांसर। बट अभी सब मेरा बहुत चिंता हो गया सर, और 32 इयर्स के बाद थोड़ा ज्यादा इफेक्ट हो गया एपिलेप्सी में हाई। जब भी था हम कलिंगा एम्स में ज्वाइन कर ली, फिर एम्स में एक साइकेट्रिक डॉक्टर को दिखाया है, अभी वो 3 साल तक देख रहे हैं। लेकिन अभी जब आप बोल रहे हैं ना स्लीप बहुत जरूरी है, सोना बहुत जरूरी है, लेकिन मेरी बेटी को नींद भी नहीं आती है। अभी बीच में ऐसा हो जाता है, मेरे को बहुत डर लगता है सर। वो क्या हार्ट अटैक हो गया कि क्या है, मेरा समझ में नहीं आता सर।
ओके, सो
सर अभी सोडियम वालप्रोट के बंद करके ये खा रही है, लिबेरा 1500।
Libera. Okay. So, Neeraj, can you just point out what Vidam was asking?
Basically, she is worried about her child who was on valparin, I guess, and now currently on Levera. She is already 32 years old, and you are worried about her future or something. That much I could understand. I was not throughout the question. Yeah, so just she is worried about how her future prospect and everything.
The female girl.
May I translate it for you, sir?
No, I understood. So basically,
actually, the baby has the lady has Down syndrome, and she is 32 years old now. So she has been having epileptic episodes.
See, the Down syndrome child usually, they can have seizures, and if the seizures are very well controlled, they will be require a long-term medications. So if your kid is having a Down syndrome, you may be consulted so many places. We cannot completely change the diseases, but they can lead a normal life. Near normal life, you can say that. So now till 32 years, if you are able to take care of him, so please continue the medications. So only depending upon these other, when was the seizures, what was the cause of the seizures, whether it is the Down syndrome which has produced the seizures or some other thing, we need to decide before stopping the medications. Otherwise, you will require continuous medication. For his sleep disturbance, for his sleep.
Can she understand medication?
Hello, can I?
Understand medication, what type of medication? वो समझ पाएगी?
Yeah, you are already giving valproic acid and Levera, that is levetiracetam. The 2 medication your child is already on. So we can continue. We can consult the doctor to make sure that the dose is appropriate for his current age. Because if you have visited the last and continuing the same dosage, it may not be the right. So we can consult your consultant and make sure that the doses are right. For other thing, for his sleep issues, let all of us here, those who are even to the from lay person to the professional, majority of us having a bad sleep hygiene. Okay, so before we convey to the patients, so first practice good sleep hygiene. In spite of that, he is not getting sleep, he may require a small dose of sedatives, ranging from small anxiolytics to the respirodol.
Yes, sir. Thank you.
Thank you, sir. There is a question in the chat box, sir. Someone has asked that they have a non-verbal 10-year-old child who had occasional seizures and was under medication. Now the parents have the complaint that she is having behavioral issues like continuous laughing and rocking. She is also an autistic child. So whether it is because of autism or it is some side effect of the medication.
See, that's what I have mentioned briefly while I explaining, because this autistic kids will have a lot of stereotypes. Okay. So the best thing is whether to blame on the medication or whether to blame on the seizures, to get a video EEG. So that will clarify because whether these rocking movements or seizures or not. Okay. If they are not seizures, so unlikely to be their seizures, the way the explanation goes, there may be some kind of a stereotypes. It is the part of the disease rather than the medication. So if you just want to confirm whether they are seizures or not, you can have a video EEG done. If they are not seizures, if it is very disturbing, then we can give a medications to suppress those stereotypic movements.
Thank you, sir. There is one more question. With your permission, I would like to answer directly. That is there any scheme or assistance from the central government for epilepsy treatment and medication for children from low socioeconomic background? So, madam, here I would just like to tell you that it is under one of the 21 types of categories mentioned in the RPWD Act, and any benefits that is available to any of the categories is available to persons having epilepsy. So you can get all the benefits of government which is covered for any type of disability. Same will be given to a person with epilepsy. I hope I have answered your question.
Sir, this is Damari Silvan. Sorry for the interruption.
Yeah.
And regarding, yes, sir, with your permission.
Yes, please, sir.
Yes, sir. Regarding that doubt, no, sir, that they are asking for the medication, the expenses, the reimbursement for the medical expenses. And we have an option in National Trust of India. So the details I shared in the chat box. The link also I have shared. So they can click on it. They will get the details of agencies they are helping to register for the Niramaya insurance card. Okay, it is mainly for the 4 types of disabilities like CP, intellectual disability, ASD, and multiple disability. So those children can register themselves with the help of their parents in the National Trust website. There is an option called Niramaya card, and there is a list of agencies in the state-wise it is given. They can take the help of those agencies for their registration, and their medical bills can be reimbursed, and they can contact those agencies. Thank you.
Yeah, thank you, sir, for highlighting this point. Sir, before I go to the next question, this information is for the participants. The feedback link for the program to get your certificate is in the chat box now. All of you, please make sure to fill it up before you leave the program. Then only you will be eligible to get the certificate for today's program. Okay, thank you. Sir, there is one more question. How to manage for tongue biting symptoms?
So that tongue biting during seizures.
Yes, sir. Yes, sir.
Yeah, if that is the question, there is no way we can able to prevent it. Okay, please do not attempt to do that. Okay, so if the person is throwing a seizure, the seizure activity is very strong. It is a very strong motor activity. So if you keep your finger, your finger may cut into a pieces. Yeah, as you mentioned previously, if you put a spoon, it may cut. So there are so many things can happen. So it may then it may go deep and may obstruct the breathing. Okay, if during the activity is about to cut his tongue, or unlikely to, the tongue can be cut into 2 pieces. Only there will be edges. It will be there. Then once the seizure stops, then only we will be able to address that. Not during the seizures activity.
Thank you, sir. There is one more question in the chat box, sir. A child is suffering from convulsions. Only 1 episode was there. They took the medications for the suggested period. However, there is a family history of convulsions in childhood. So the parents are worried whether or not in future also it might be an issue for them, or they need not be worried for this.
See, there comes the concept of the hereditary epilepsies. Okay. So hereditary means those who are having, if the family person is having a seizures, the next generation develops the seizures. So to make it simple, the seizures, if it is in the hereditary or in the family, it will behave like those it was there for the the previous generation. If they are well controlled and if they are off medications, we can reassure them that your child will also be off medications over a period of time. So otherwise, other way of going by evidence-based means we can do a genetic test, identify which is the abnormal gene, then we will be able to categorically say that whether your child will be requiring medications for and what will be other consequences. So that is the evidence-based way. Otherwise, you can just take a deep family history that will help us to do a counseling or to predict the outcome in those cases.
Thank you, sir. One last question we will take today. There is a question someone has asked, is it advisable for patients with epilepsy to take marijuana smoke for treatment? I don't know, I think he wants to write marijuana. So
see, the answer is yes, but we have to understand the limitations. Just because epilepsy cannot address that. So there are a few purified forms and unpurified forms.
1 minute, sir. I think someone else. Yes, please. Yes, sir.
Yeah, there are especially for Lennox-Gastaut syndrome, it is one of the drug of choice nowadays. So for Dravet syndrome also it is coming in a big way. There are certain epilepsies, yes, it is helping, but it's that it has to be, we have to be double careful. Please don't advise them to take unpurified or other things. You can get a proper medical advice, and with medical supervision, depending upon the case, you can use that.
Thank you, sir. With your permission, I would like to request the participants, if anyone else has any question, just one last question, you can unmute and ask to sir directly. Otherwise, we will close the program now. If anyone wants to ask.
No, doctor.
I think we can take a question from Karnataka.
Marvelous and
anyone from Karnataka in Sun possession? Yes.
Really, it's a heartful thanks from our side. See, we are managing children with cerebral palsy. So most of the children are having epileptic disorders and on medications with certain institutions and hospitals. So most of the parents have that concern that there is memory loss due to this regular medications. And as specialist educators, when we try doing so many cognitive activities, again, they just come back to their normal. So are there any suggestions, doctor, to upgrade their cognitions level?
See, I think this question I have answered. See, here you need to understand the two things. One is the underlying cause of the seizures, and the next thing is the medication. Okay. So, and majority of the parents having a lot of misconception about medications. It is very easy to blame the medication before understanding the disease. So especially not only in neurology, any long-term diseases. Okay. So they will just blame the medication because he's taking the medication, because of that he is dull, he is not performing, and so on. So if you don't give the medication, it will be worse than that. Okay. So please try to understand, make sure that the parents have understood the disease properly. Because if the child is having a moderate or severe intellectual disability because of the underlying diseases, the medication may not worsen his performance. Okay. Yes, Yes means yes, if the child is on polypharmacy, multiple drugs, still seizures are not controlled. If he is taking very irrational combination of the drugs, where his performance can be affected because of the medications. But by and large, in these case scenarios, the underlying, because of the underlying diseases, his performance will be low rather than the medications per se. So before blaming the disease or medication, first we have to make sure that he is taking the right medication at the right dosage in the right combinations. If they are right, unlikely the medications will be causing or will be affecting his performance. That we have to convey to the parents clearly. Otherwise, what will happen means they will stop the medications.
Very rightly pointed out, sir. This is a very common concept that the parents are mostly having, that whatever the side effects are there is because of the medication straight away. So as you have rightly pointed out, yes, it needs to be found out whether or not they are on the correct medication in the correct dose. And for that, you need to seek professional expertise from sir or from any consultant neurologist, and then you can go ahead. The newer age medications have now been made so that there are minimum amount of side effects whatsoever. So that was that was a very enlightening session, sir. Thank you so much for patiently answering all our queries and answering the queries of the parents. I am sure today each and everyone present in this program would be very much benefited about what epilepsy is, and at least they will be able to tell someone what not to do, or whatever wrongly was being done, at least they will be able to dispel all those myths that are associated with epilepsy. So thank you so much. Once again, I would like to thank you, sir, for taking out time from your valuable schedule and coming for this program. We hope to have you in our future programs as well.
Yeah, so sure, definitely. I will be like to be associated, because since my practice, I am more oriented or more do work towards the disabled or specially challenged kids. So, and again, I thank the CRC for doing a wonderful job in this region of Karnataka. So please, you can expand, as some sir was telling, you are starting early intervention center and opening the new center. So these kind of centers are required, I think, at least one for each district. If not for one in each district, at least for 2, 3, or 4 districts, because the amount of the load is more than whatever the services are available. So I thank CRC for inviting me and for their wonderful job they are doing in this part of Karnataka. Thank you.
Thank you so much, sir, for your words of encouragement. And yes, we are trying to reach out to all parts of Karnataka through our community awareness programs and benefits, DIP schemes and other schemes that are by Government of India. So we have a team of dedicated professionals who have expertise in various domains of rehabilitation and skill development and empowerment. And sure, with help from all of you, we will be able to try and help out as much as possible. So thank you once again, one and all. And special thanks to our director in charge, Dr. Ganwell K. sir, for giving us an opportunity to conduct these programs. Also thanks to my colleague and coordinator of this program, Dr. Thamrai Silvan, lecturer at physiotherapy, and to all faculty members and staff of CRC Davanagere for providing a helpful support during each and every programs. And last but not the least, to all the participants without whom this program would not have been successful. Thank you. Thanks a lot again. I am sharing the feedback link for the last time. Kindly make sure you have filled it. You will get a certificate in your email exactly 5 minutes after you submit the feedback form. Thank you again. Thanks one and all. Thank you. Thank you, sir.
Hello. 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 Good evening, sir.